It's a pleasure to have Byron Patterson joining me today. Not only a physician, but a world-class All-American athlete. So this is a unique opportunity to talk about how athleticism informs medicine. Tell us a little bit about your background.
I hate talking about myself, first of all. I was fortunate enough to be a decent athlete growing up in the Bay Area, and actually competed in track and field as a triple jumper, and did well enough to finish, I believe, 7th in the nation and became a high school All-American. Ultimately, it got me into college and was able to compete in college and became a collegiate All-American also in the triple jump.
So let's jump to the medical side. How did medicine get included into that career path of athleticism? And how does it influence your life today as a physician?
Right. Well, first of all, sports really was just kind of my dream. It was like everything that I imagined that my future would entail. And somewhere along the way, I figured I wanted to be a role model, and medicine kind of became a perfect fit for that. So I actually got into med school and got into residency for pediatrics. Halfway through pediatrics, I realized maybe I want to test the water, see what else is out there. So I did a sports medicine elective in residency. And the minute I walked into the clinic, I was like, this is my calling. So that's what got me into sports medicine. And ever since, it's just been a blessing.
So treating the elite athlete is a challenge, because I think that the nature of the competitive set demands optimal care. How does that push you or change some of the practice dynamics in that sense?
Well, I think I treat everyone as an athlete. I think even people who are sedentary have the potential to be an athlete. I think it's kind of the direction of our society. We want people to live and have a healthy life. And so exercise really become an important component of that. And as an athlete, we typically are not the best people in regards to injuries. Athletes typically push themselves way too hard, push themselves through pain, and we're actually the ones that are often receiving or actually getting the worst injuries. I think for the lay people in general, they don't push themselves as hard to sustain those type of injuries that athletes get. But to understand and to inform people about pain, I think, is really important. And athletes really understand their bodies. They really understand when they're in pain, but we're also good at blocking out pain. And so I think, as coming from the medical side of it, I'm able to educate my patients and individuals about pain. And that pain is the first step that the body signals that something's wrong. And that's what needs to be addressed. If you catch it early enough, you really modify and improve that outcome of that initial pain signal. But if you ignore that pain, that's when you get the big injuries. So my background actually just kind of allows me to relate to individuals who have pain.
You talk about pushing yourself and the construct of the elite athlete pushing themselves. I'd like you to comment on how technology is pushing the bounds of care, both from diagnostic to therapeutic.
Yeah, I think technology is it plays an intricate role in the advancement of medicine as a whole. I think at least for myself, when I first started practicing, there was a lot of things that we did completely just by feel. And little by little, as the technology advanced, it really has allowed us to provide a better care for our patients. And now with the advancement of initially MRI machines, where you would have to wait forever to get an image and the machines were cumbersome, now the images are nice, cleaner, but you still have to wait. So if you want a patient to get an MRI, you have to wait a couple of days, 3 or 4 days, and you're not really treating the patient as they come in to handle that injury at the time. Now we have ultrasound machines that a patient can come in with pain. You can look at that injury dynamically and have an answer right at your fingertip. So I think it's just a great advancement of medicine. In sports medicine, where musculoskeletal plays a huge role, to be able to evaluate those injuries acutely, to be able to have an athlete, for instance, if I had an athlete who had an injury and they're in the middle of their season, high school seasons are very short. So if it took me 3 weeks or 2 weeks to make a diagnosis, the season is halfway over for that athlete. With now technology, I can look at the athlete, look at the injury under ultrasound, make a diagnosis, and start treatment right away to get that athlete back into the playing field, maybe in a week or in 2 weeks, where in the past it would have taken us 2 to 3 weeks just to make the diagnosis.
How is ultrasound emerging as an important diagnostic and therapeutic tool that is smaller and potentially more practical?
I think it's amazing what ultrasound has done. When I first started doing joint injections, I would do it under fluoroscopy. So not only am I irradiating the patient, I have to go to a different facility to set up an injection. And now you can do it right at the bedside. You can get a real-time image of that joint, the actual needle going into the joint, the accuracy of that, and seeing that the medicine is being dispersed within that joint. So that's all in that initial visit. And you don't have to delay that process, where in the past we would have to delay that process. And even now, because ultrasound unfortunately is still not the standard of care, a lot of doctors still have to resort to either doing blind injections or doing it, like I mentioned, doing it under fluoroscopy, which exposes the patient to, I feel, unnecessary radiation.
You mentioned a term that really resonated with me, and that's a blind injection. Let's flip that around and talk about the era of visual medicine, the ability to visualize, to cognitively process data, and even to speak with a patient or caregiver. How is that changing your practice, and how do you see that moving forward in the future?
I think it goes hand in hand for what we do, at least in sports medicine. And I think the patients who come into my practice really appreciate the fact that they can see with their own eyes what we're doing. And I think patients who've had bad experience with injections will come in and have an injection done with direct visualization, and it's night and day. They're expecting the worst. They're expecting the needle maybe potentially hitting their bone or causing extreme amount of pain, and they come out with very little, they have very little symptoms from the actual procedure. And that's really rewarding, that the patient can walk away and go, wow, that wasn't a bad, I was expecting much worse. I was able to walk away and it feels great. I think we're just at the tip of the iceberg. I think we haven't even gone under the water to see the full capacity of what visualization on that side of medicine, what it will provide for our patients. I have patients who come in and they're my biggest advertisement. They go out and tell other people their experience. When they've had other procedures done blindly, they come back and have such a good experience that goes out and tell other people. So I think the patients will start demanding a higher level of care. They're going to want to have what everyone else, or at least what my patients are getting. Other people are going to want to have the same thing. So I think over time, other physicians really will have to learn this technology and incorporate it into their practices.
So is it fair to say that superior accuracy, superior performance can ladder up to superior care? Are patients seeing clinical results that are superior? Are clinicians seeing clinical results, or is it more procedural?
I think it's a combination. So definitely with procedures, it helps, whether it's done blind or through direct visualization. If you're actually able to get into the joint, you hope that the patient has a positive response from that. Diagnostically, I think is where it really is going to come in more beneficial, where we can actually see an injury and maybe not need to go get an MRI and start to determine whether or not the level of care at that point, what is the next step? So in my case, I'm a gatekeeper between the surgeon and the patient. So my job is to pretty much treat the patients conservatively through physical therapy, rehab, injections, to see if they can overcome their injury without needing surgery. So 90% of my patients, even with a diagnosis of like a labral tear for a shoulder, for instance, just because the labral tear shows up on the MRI doesn't mean that it's causing symptoms that need to have surgery. And so typically most of my patients, I will do a course of physical therapy. I'll visualize but prior to doing the physical therapy, I'll visualize their injury and see just how much the joint is being compromised through that injury and how restrictive is it. Because the MRI doesn't show you dynamic instability per se, but the ultrasound can. And so if I see that an MRI may show or document a labral tear, but yet the joint is fairly stable, I can recommend physical therapy for the patient, rehab them, and in 6 months, if they're back to their baseline or they're pain-free, regardless of what shows on the MRI, they can return back to their activities. And that's really the most important thing that I can provide my patients, is to see how their injuries are affecting them dynamically and what restrictions they are. Now, if I have a patient who is constantly in pain and no matter what I see on ultrasound, then I may recommend surgery as an adjunct. But for the most part, that's not the typical course that I would do for my patients.
How are patients adapting to new technology? Do they see or potentially feel advantages that allow them to become an advocate for this process?
I think patients are becoming more educated in general with the fact that they can get so much information off the internet. And I think that people now know that this technology actually exists, and so they're actually requesting, well, can you look at my shoulder under ultrasound, even though it may not even be indicated. But I think people are demanding that higher level of care. And the good part about that is that it's not as expensive as an MRI. It definitely is less radiation than getting an X-ray. So as long as there's an indication, it definitely provides valuable information and a valuable tool that we can provide the patient. And so obviously that communication between the doctor and the patient is invaluable. And so a lot of times, you know, a patient will come in with a little muscle spasm, and they'll look on the internet and say, I think I have some kind of neurological, you know, condition. And I'm like, so how long has that been lasting? Oh, only about 10 seconds, and it's only once. So, you know, you kind of have to help the patients understand what are their realistic understandings and what is the realistic approach and treatment. And I think with the new technology out there, we are definitely able to provide better diagnostic information that allows them to really benefit from the care that we're able to provide.
Great. Thank you, Dr. Patterson. It's been a pleasure speaking with you.